Cervical cancer is caused by the human papillomavirus and, according to the CDC, is the most common sexually transmitted infection in the United States. According to the World Health Organization, comparatively, cervical cancer is the fourth most common cancer among women, with 660,000 new cases and 350,000 deaths recorded in 2022. The highest rates are in low and middle income countries.
Every 2 minutes in the world, a woman dies from cervical cancer. So the idea of eliminating cervical cancer is early detection, early screening, and early treatment.
Dr. Will Ngwa, the director of a global health organization called the Global Health Catalyst, working to bridge disparities in cancer care and treatments, talks about the urgency in Africa.
So in Africa, we believe that there'll be about, the estimate from the Lancet Oncology Commission is that by 2030, we'll have about 1 million cancer cases, deaths per year, right? And right now we have about 550,000, more than that, deaths per year. But because of COVID and other factors, we actually underestimating, because right now, like you and I discussed, people even die of cancer and don't know they are dying of cancer. As we get this awareness that you're creating, people get aware about it, you realize that there are more people dying. So it's a pandemic worse than COVID. If we really have to look at the COVID-19, just based on how many people is killing, we need to bring that same urgency to cancer. And so, in sub-Saharan Africa, from those statistics, there are about 120,000, cases per year for cervical cancer. So it's second after breast. But in terms of death, we 70% of those, about 70% of those with cancer die. And so that's about 80,000 women dying per year.